Joining us on the hotline, as we do each and every week, is Dr. Dan Zanotti from the Center for Orthopedics. Hey, Dr. Dan, how you doing?
Doing well, Dustin. How are you?
Doing pretty good. Want to talk today a little bit about high ankle sprains. Jerry Jeudy, a wide receiver from the Denver Broncos, suffered one this past weekend, and the x-rays were negative, but can you just talk a little bit, Dr. Dan, about what a high ankle sprain actually is?
Yeah, it's a pretty common injury, Dustin, in football, as you know, and you'll probably be hearing more about these over the next few months with the NFL starting. But a high ankle sprain is a little more significant injury than a regular ankle sprain. It involves the ligaments that connect the two bones in your lower leg, and it extends up higher than just the ankle joint. That's why they call it a high ankle sprain. So more significant ligament involvement, more significant swelling and inflammation, and longer healing time with these injuries.
Why does it take so much longer to heal?
The ligaments between those two bones are very important, obviously, for stability. So you have to let those ligaments heal in order to get the strength and stability in the leg. Additionally, it also causes a bit more pain than a regular ankle sprain. So these injuries tend to be a little more swollen, a little more painful, and hence the longer recovery.
And the recovery includes what in terms of the treatment and rehab?
Well, just like any sprain, obviously rest, ice, the usual things they do to get the inflammation to calm down. And then there's a rehab time associated with them in terms of getting the strength back, getting the agility back in these patients who are obviously high-level athletes. So first the rest and then a lot of rehab therapy to try to get the motion and function back.
Is there ever surgery as an option?
There are for particular sprains that involve complete disruption of the ankle joint. Now, unfortunately, that's pretty rare. But there are occasions where the two bones tend to separate, and you do have to go in surgically to stabilize them. It doesn't sound like that's the case in this situation, but that certainly can be a bad situation if it does require surgery.
Well, there he is, Dr. Dan Zanotti with the expertise. As always, we appreciate the time, Dr. Dan.
Anytime.
Dr. Dan Zanotti from the Center for Orthopedics. If any of you guys have questions or concerns, give them a call at 440-329-2800.